As far as I'm concerned, it's a complete failure of care that occurred between 2014 and 2017. There were 157 people who didn't have their follow-ups done correctly, and that needed to be corrected. And it was quite clear that the reporting mechanisms and the escalation mechanisms within the department at that time didn't work in this instance.
One thing the Health and Care Association said last week was that one of the reasons they wanted this in the public domain is because they believed it was quite critical. Do you think that's a fair assessment of the report?
I think the report hasn't really drawn out anything that wasn't investigated by the Social Affairs Policy Review Committee. As I say, I was actually on the committee when this investigation was taking place because it was prior to me becoming minister. And I think what is important is that the follow-ups were then, once it was identified in early 2017, all done and completed by August. But what critically has happened since then is that the processes and procedures have changed as well. So although the report quite rightly is critical of what went on, the action plan that people will find at the back of the report, the department has been implementing since that time.
So how much of that has been implemented?
So, for instance, there has now been a consolidation of the endoscopy, which at the time was quite controversial. Again, I was on the investigatory committee for that when it was transferred from Ramsey to Nobles. The capacity has increased as well. So, to give you some example of that, over the last 2 years, the capacity of endoscopy going through the system has increased by 64%. So in the last year of the period we were talking about, 16-17, which the report covers, there was 2,112 endoscopies done. Last year, in the last financial year, between the April and November figures, because obviously we haven't had December and everything yet, so between April and November, there was 2,570, and that compares to so far between April and November this year, 3,462. So that's quite a big change in terms of capacity. But the other thing that is absolutely crucial that has changed is the way that clinical leadership is done in the section as well. We've now got one team in place with one clinical leadership, and that should ensure that communication, which is absolutely key to this, continues to be properly done. And also we now monitor as well the surveillance routine, so those who are coming back for endoscopy, and at the moment it's running at 98% of plan.
In one section of the report, they mentioned that they spoke to clinical staff, to non-clinical staff, and some of them mentioned that the service felt like it was designed around finance rather than quality of care. Is finance a big issue for this service?
I think finance is an issue, obviously, with the whole remit of health and social care. That's one of the reasons we've got the Sir Jonathan Michael review taking place to look at the whole way our services are delivered. But I think what is crucial is that, and I need to make this point as Minister, that finance should never get in the way of patient safety. And again, I'm not going to try and run away from this point. What was investigated and found was a patient safety issue. And patient safety should never be compromised due to finances. That is absolutely critical.
As well as finances, this was mainly a report looking at policies and the admin side of service rather than the actual clinical side. How important is it to ensure that those clerical issues don't get in the way of clinical practice as well as finance?
Absolutely critical, and that's one of the reasons that the way that reporting and also the referral pathways are done has been changed since this investigation as well, because you can go one of two ways. You can either have too little admin, which then results obviously in problems of people being appropriately covered and you having the records, but then you can go the other way as well and create a completely bureaucratic system that nobody can work around and nobody can properly use, and that slows things down. It's about getting a balance in terms of administration and making sure that you've got the correct records of the patient and that you're following that patient through its entire pathway. And that is why one of the key points in that action plan and one of the key points that the department picked up after the report was in terms of the referral pathways and following patients through their journey, not just to their first endoscopy, but also their follow-up.
You mentioned that capacity has already been increased within the service. Is that through efficiencies or have more resources been delegated?
There has been more resources put into endoscopy, but also, I should point out as well, demand has increased as well for the service. And this is always the catch-22 with any health service we provide. You mentioned before about finance, and the plain and simple blunt fact is health, if it wished to, could probably absorb the entire Isle of Man government budget, as I'm sure in the UK it could absorb the entire UK budget, and you'd still never be able to provide everything. But what is crucially important is that any services that we do deliver are done in a safe way, and that is the crucial lesson from this report.
Does it create problems elsewhere when you have to put more resources into one sector like endoscopy? Does it take away from somewhere else?
Well, actually, the Isle of Man Treasury, of course, over the last few years has given more and more money to the department. So we certainly don't try to slash other services in order to increase another. We have to look at efficiencies as well, and the way that we do things, and the consolidation of endoscopy at Nobles, which at the time, again, I was on the investigatory committee, the department said would be able to increase capacity and it would make it a more efficient service. At the moment, that appears to be working. But as with all services in health, it is seeing increased demand, and we have to look continuously at how we meet that demand.
Just finally then, is this report the end of it, or will there be further monitoring in the future?
No, endoscopy waiting lists are monitored quarterly. It also comes to the department board meetings now in the hospital services report. So myself as minister, each month I see an update on endoscopy. So no, this report isn't a case of job done, move on. As with all our services, they need to be properly monitored and appropriately monitored at all times, and that's going forward. This was a failure in patient care, and the steps that now have been taken to correct it, they need to be ongoing steps.